With more medical coverage now. Today there's an educational program on joint replacement going on in Lincoln, and here to tell us about it is Dr. Scott Paxton from the Miriam Hospital and Rhode Island Hospital. And doctor, what are some of these symptoms for joint replacement? When do you know that you need to get a joint replacement?
So in general, folks who have problems with their joints, arthritis is the most common reason why we do joint replacements, are going to have stiffness and they're going to have pain. And these are going to be things that have not responded to conservative treatment. Generally start with lifestyle modifications, anti-inflammatory medications, and then proceed to intra-articular injections or injections into the joint of steroid that help calm down the inflammation. Once those have stopped working and the patient is debilitated, they're not able to do the things they want to do, they make the decision in combination with us with some counseling, and that is when a joint replacement is generally discussed and indicated and can give them pretty good relief of their symptoms.
Now, I would imagine most of your patients are older, but are you starting to see some younger patients for joint replacement?
Absolutely, yeah. The indications for joint replacements are evolving. The kind of tried and true general patient that you're going to see a joint replacement in is going to be on the older side of things, but what's older is always a little bit of source of debate too, because some would say that a 60, 65-year-old person's not old anymore. So we look at physiologic age a fair amount too with other medical problems and demand level, but we have newer and newer technologies, newer and newer type of implants and techniques to put the joints in. So younger and younger patients now are able to get the benefits, whereas before we might have thought the longevity of the implant wasn't quite what it should be to put it into a younger patient.
And you mentioned that newer technology, so what's the surgery and the recovery process like? Is it shorter nowadays?
Yeah, so we've really done a lot of work, especially at the Joint Center at the Miriam, with trying to get patients in and out of the hospital and also beginning rehab soon. So for a shoulder replacement, generally the patient will come in the day of surgery, and this is after a preoperative evaluation with our dedicated team to evaluate them. They meet the anesthesiologist, make sure they're healthy enough to undergo surgery. They come in, have the surgery. It takes maybe an hour and a half, 2 hours to do. They'll generally get physical therapy starting that day with a one-on-one therapy session, and then for the most part, the patients are going home the next day.
Wow.
So, the therapy and the rehab continues after that on an outpatient basis, but we try and get patients in and out and get them back to their house where they're usually a little bit more comfortable in the hospital.
Absolutely. All right, so kind of tell us what's going on at this program today in Lincoln.
Yeah, so we're going to be at the Lincoln Senior Center today from 10 to 11:30. Me and one of my partners, Dr. Derek Jenkins, who does hip and knee replacements, are going to be there. We're going to be presenting on general information on shoulder, hip, knee, arthritis, replacement surgery, kind of newer techniques, what patients should expect, and then also we're going to be taking questions from the patients and from the, I guess I don't know if they're patients yet, but from the people who come to talk with us on any, try and get rid of any misconceptions they may have about joint replacement, try and set their mind at ease if they think they are a candidate for it, and let them know what to expect.
And what time is that today?
It's from 10 to 11:30.
Okay, doctor, thanks so much for joining us here this morning. And if you want to see the interview again in its entirety, just go to our website, WPRI.com.